So, I wanted to talk to you today about breast health. I ask a lot of women about their breast health and about their relationship with their breasts, and oftentimes they have nothing to say about it and they're not even thinking about breast health, unless of course there's been some family history with breast cancer and that kind of thing that give them some concern in their younger years. Most women, however, don't really consider breast health until their doctors put them on the mammogram schedule in their 40s, mid to late 40s. um, However, there's a lot you can do and there's a lot to think about with breast health, and not it doesn't have to be in a like, ugh, god, another like thing to think about, or in a burdensome way, but it can be in a really beautiful and nurturing way. The breast tissue is um, full of lymphatic um, lymph tissue, and it's incredibly important and valuable that we make sure that the lymph in that area stays moving and doesn't get stuck or stagnant, which is really super common, especially if you've been wearing a bra since your preteen days, or wearing underwire bras or tight sports bras and that kind of thing. Our bodies, our breasts were really designed to kind of move with every step we take, and that meant that with each step, the lymphatic fluid was moving and there was more movement in that area, which is not really the case in our modern lives these days. And so it's really important to kind of understand and get to know the tissue, the state of your tissue in your breasts. You can do that with some self breast massage. There's lots of videos online you can find. I do lymphatic breast treatment, so we kind of like do a breast check to check the state of your tissues and see how things go. I usually teach a breast massage in that treatment as well. But the breasts are really incredibly important, and there's a lot of things you can do to kind of keep things healthy and happy and in a positive direction, so that you can avoid some of those scarier things later on. There's other things you can do besides mammograms also. There's thermographs and ultrasounds, and a lot of those are really good to start younger also, so that you have a baseline. It doesn't, you start whenever you start, but the younger you are, the earlier of a baseline you have, and then you can kind of go from there. But it's the same thing from understanding your own tissue and how things feel, and you can change the tissue. You can change the consistency and the tone of your tissue. There, you can increase size. You can change the shape, the texture of your breast tissue. So if you tend to have more like fibrotic or cystic tissue in your breasts, then you can change that through movement, through massage. There's a lot of really good salves and creams and oils that support that. There's a lot of great supplements to support your breast health and the breast tissue, like iodine and magnesium and vitamin E. There's good foods that you can do to kind of increase that. There's essential oils that support the breasts and all kinds of things. So breast health is really something to think about, and I really like to advocate for that. And way before things get into a scary situation, it's really good to inhabit the breast tissue and really kind of connect with that. When you embody and really embody the breast, you really kind of live from the heart and you open up. And everybody has kind of their own story with breasts, and we do live in a very interesting culture where there's lots of mixed signals on how we should be. But breast massage and lymphatic massage in the chest area is incredibly beneficial for all women, especially if there's been any surgery, so implants, explants, mastectomies or reconstructive surgeries, anything like that, absolutely. But even if there's not and you want to be preventative, it's a really beneficial and beautiful process that really helps you kind of embody and connect with that incredibly nourishing part of you that whether you breastfeed or not, your breasts are there to really nourish and feed you in lots of different ways. So I definitely encourage you to, you know, approach your breast tissue in a different way and really explore and, you know, look into some breast self massage, or you can schedule an appointment with me or another breast therapist, anything like that, and that can help kind of help you kind of navigate that area and bring that into the fold of your self-care. It's a really beautiful and a really important piece to a woman's care. So I hope this helps, and if you have any questions or anything like that, feel free to comment or email or direct message or